He also noted the issue of quarantines. Listen.
We're currently managing over 250 cases of H1N1 flu in one sector in Rio Grande Valley where we have an outbreak. We now have 2 pediatricians that we've deployed to the main station where these individuals are quarantined. That's just a snapshot. ICE has over 4,000 people in custody that are in quarantine.
4,000 people in quarantine, Dr. Drew. Number of physicians for 250 people?
Well, it doesn't sound like it. I'm not there to know exactly what their needs are, but I'm telling you, this is the big picture problem. There are policies that are ideologically driven that are resulting in human catastrophe, one after the other. We have to have a pragmatic approach for the people of this country that is realistic about what it means to have people in concentrated environments, whether it's a city or whether it's an encampment of some type. These are all ideologically driven, and when you put people, when you create these circumstances, it's inevitable that infectious diseases break out. You must attend to the reality that we have for the last 800 years in our civilizations that somehow, because of our current ideologies, we've decided we don't need to attend to.
Dr. Drew, if you could write the policy that would minimize the risk of a spread of infection either within a migrant population that's being temporarily housed somewhere, whether it's youth, young people, or adults, or to the public at large, as a physician, what would be the proper protocol to put in place?
The proper protocol would be to have each individually evaluated by someone with a board certification in a primary care specialty. That would be the ideal thing. That will never happen. So the next best thing would be to have physician extenders like nurse practitioners and physician assistants under the supervision of a board certified primary care specialist watching this and supervising it as it took place. This would be very expensive. Very expensive.
Well, very expensive, and when we have 140,000 people, as we had in the month of May, Dr. Drew, coming across our border, just the people we've apprehended, that's an entire small U.S. city. That's an enormous amount of resources and manpower that, frankly, the federal government right now just doesn't have and doesn't employ.
I agree. I don't think it could be properly done. That's why we must get this thing under control.
Dr. Drew Pinsky.